Gina Thorne joins me here live in the studio. She's going to help us play the music here for the next hour as we head into your drive home. And if you don't know who Gina Thorne is, man, where have you been, right, Gina?
Well, they're not listening at 9 o'clock on Friday morning.
That's right. So we're moving Gina around. We're going to she's going to become Flex Gina.
I am, yes.
You like
I'm
that?
very excited about that
Working
title.
on your yoga? We've got to make you more flexible.
I sure do. So it's very exciting to be here in an afternoon setting.
Well, we appreciate it. Gina Thorne, of course, is part of the professional team at Lakeview Health, and that is a drug and alcohol rehabilitation center, community, if you will, that's located right here in Northeast Florida. How would you describe it to folks if they're tuning in and listening to you for the first time? How do you explain to people what Lakeview Health is?
Well, we call Lakeview Health a place where people can actually get their life back on track. We have a lot of people that come into our program who are struggling with substance abuse and mental health disorders, and they need a place to go where they can actually find their purpose, find their what we call their true north, their direction of getting back to a place where they're getting rid of the chaos and pain that they're struggling with. And so our inpatient residential program is designed exclusively to meet the needs of men and women separately. We're a gender-specific program. We just opened our new women's program in June, and we have our men's program, of course, operational and moving forward. And it's just a safe, very open place for people to go and get access to the treatment that they need so that they can learn how to live life on life's terms without drugs or alcohol.
Gina Thorne, once again, with Lakeview Health. You can learn more by going to lakeviewhealth.com. But just as importantly, you can call this telephone number if you have any questions. Maybe there's a loved one, there's somebody in your life that you're just trying to get some information about. You want to help them because they are struggling with drugs and alcohol. You can call this number, toll free, 866-316-5113. That number again, 866-316-5113. And lakeviewhealth.com is the website. That's lakeviewhealth.com. And Gina, we're going to talk a little bit today about interventions. You know, I think there's even a television show about interventions, and there's been a lot of movies and a lot of, I guess that's the Hollywood side of what is a pretty difficult circumstance for so many families out there. The notion of, can you intervene? Can you actually help somebody who is in the throes of a drug or alcohol addiction? Can you help them through interventions?
Right. So a lot of people have, like you mentioned, a very interesting perspective of what interventions are about. They think that it's really more about this 1 hour show where you get in there and you confront the loved one and they get angry and upset, or they immediately go to treatment, which is always the preferred way to go. But the reality is that there's a lot of prep work that goes into doing an intervention. And I know that there's a lot of people listening right now that have family members that are struggling with this disease. And they can't decide whether or not their loved one even has a problem. And we've talked in the past about how oftentimes this is a continuum. This isn't a do or don't. It's not a black and white issue. People literally are on a continuum of this disease where they might have started out recreationally using, but over the course of time became addicted through the use of drugs and alcohol. And so what we want to do is assess the situation and determine, do they really need treatment? Do they need inpatient or outpatient treatment? And many times families just don't know. They don't know what kind of questions to ask. They don't understand, whether or not the behavior is significant enough. We've got families that have loved ones that are not using Monday through Friday, but come weekends they're binging. And that's dangerous. That obviously is a precursor to some serious addictive behaviors that needs to be addressed and can't be ignored. And so today I'd like to talk about what interventions are about, what they're really about, because as you mentioned, they can be sensationalized on TV. And it's not a 30-minute kind of situation. You really do spend days, with some cases with professionals, really working with people on setting the stage for that moment where you have a chance to confront that loved one and help them get treatment right away. Because as we all know, this is a fatal disease if it's not taken care of. And so I do encourage you to give us a call. Our intake department has people staffed 24/7 to answer questions in regards to whether or not you or someone you know is struggling with this disease. We want you to call us at 866-316-5113 so that we can help you assess whether or not your loved one needs treatment. And then as we're talking today, Kevin, I'd like to just go through some of those key points of what people need to look for, and then also maybe some basic steps. Now, the information that we're going to go over today is actually available on our website at lakeviewhealth.com. We've got a comprehensive intervention guide for families that they can download, no cost at all. And the goal, of course, is for them to really understand what this whole intervention process is about, because it's really about love and compassion and empathy. It's not about getting in front of somebody and telling them how angry you are and how mad you are at them because of their behavior. They already know you're mad and angry. What we need to do is figure out a compassionate, loving solution to the problem.
Very interesting, because you're right. On the TV show, all we ever hear is that why they're all mad and angry.
It's true.
Which
and
makes for great TV, I guess.
Well, I mean, people aren't going to watch it if it's all about sunshine and roses. And, the other thing to think about when you're watching those shows is literally at least a good 30 or 40 minutes of the show is about the addictive behavior. And I wish they spent more time showing the outliers and the positive things that happen from people who, after they go to treatment and get intervened on, are doing well. So, and there is a lot of success stories out there. And I think that's important to mention to our listeners, that many people don't realize that this addiction thing can be beat. There are people that are living and breathing and walking in your communities today that are in recovery, and they're functional members of society. And so if you're listening today and you're really struggling and you need help, please give us a call or visit us at lakeviewhealth.com and click on that live chat. Speak to someone right now, because I know that they'll be available to answer your questions and help you find that solution.
Once again, that's lakeviewhealth.com, and that was Gina Thorne's voice that you're listening to, and we'll be right back. The Beatles, obviously, on 103.9, and we're playing the greatest songs ever made, and we do that 24 hours a day. We appreciate Gina Thorne being with us this hour, though. She's helping us play the music, and we're talking about drug and alcohol addiction, and more importantly, recovery. This is a special month.
It is. It's Recovery Month, 27th year of Recovery Month. We're really excited. This is a special month for us because we get a chance to showcase all of the really amazing people and the great journeys that they've taken to their journey of recovery. And so if you're in recovery, kudos to you, and we ask you to be a part of that movement. We've got lots of great activities that are happening in the community for those of you that are wanting to join in this celebration of success. You can go onto our Facebook page for Lakeview Health and learn more about all those activities that are happening, because it's a constant sort of evolving process. And unfortunately, we hear too much about the collateral damage of this disease and not enough about the positive stories. And so we really want people to use this month of September as well as an opportunity to celebrate.
Because that is true. There's so many people out there listening to us right now, and they appreciate the work that you and the entire team at Lakeview Health, what you do to help people who are drug and alcohol addicts. But a lot of folks out there are pretty cynical. They feel like, once an addict, always an addict. Tell us and them, or whoever we are out there, anybody that has doubts, help them understand why there's a lot of success out there.
Well, it's about being around other people in recovery. It's about understanding that this disease is a manageable disease. If you think about those people that are struggling with chronic diseases like diabetes and hypertension, they have to manage it no differently than those that are struggling with addiction. Unfortunately, our culture and our society ends up doing a blame and shame kind of situation with our folks that are in recovery, and so it's a lot harder for them to get the kudos that they deserve when things are going right. And so when you think about folks that are openly and honestly sharing their stories of recovery, we need to be able to celebrate those folks and recognize that recovery journey is possible. I know that a lot of people think about it as a chronic relapser kind of condition, but there are those that do it really well the first time, and then there are those that might have to take one or two slips before they get it. And so it's okay, though. I mean, I think that's the important thing we need to let families know, is that recovery journey is possible, and there are people out there in our communities that are, in some cases, 25, 30 plus years sober, that are functioning as a support system for those that are in new recovery, those that are coming out of programs like ours at Lakeview, who are 30, 60, 90 days clean, who are functioning as a support system for them. We have really robust recovery support systems here in St. Augustine and in the North Florida area. So if you're looking to get into a 12-step meeting, or if you're trying to find a merit group that can help support you in your sobriety, we invite you to give us a call at Lakeview Health. We would be happy to help you with that. Our telephone number, again, is 866-316-5113. We can be a resource for you or for your families who are struggling with this disease, or for those of you that want to openly share your story. I mean, we've had people from the community come in and tell their stories to our own patients who are in this early walk of sobriety. So sometimes you need to share that strength, hope, and experience of what you've gone through with others in order to help them be successful.
That's right. Gina Thorne is with us once again from Lakeview Health, and of course it is Recovery Month. And one way some people out there may feel motivated to finally get things rolling a little bit to help a family member, a friend, neighbor, coworker who clearly is having challenges and a tough life experience because of drug and alcohol addiction is to intervene, or to have an intervention, which has become I guess here in 2016 is part of our common vocabulary, right? Everybody knows what an intervention is.
Well, I think they know.
I think they know.
Sometimes they think they know. It's important to note that there's a couple of different ways that you can do an intervention. So if you're sitting there trying to figure out, do I talk to my family member or my friend about what's going on with their behavior? One-on-one conversations are good, but to be dramatically more successful, it's important to get a group of people together of those that are loved ones that are tied in and around that person to help them with their interventions. It's also important to recognize if there is an actual drug or alcohol problem. And there are some questions that you can ask yourself and ask the loved one in regards to some warning signs to look for. So, for example, have you noticed that your loved one has developed a tolerance towards their substance? Are they an opiate user or they're an alcohol user and you're noticing that they're drinking a whole lot more or using a whole lot more than they used to? Does it take more time of the substance to produce the same effects on them? Where before they could just drink a couple of beers, are they now drinking 4 or 5 to get the effect that they had before? If you see a substantial increase in their use, then there's probably a sign there that something's not right. Are you noticing if your coworkers are coming to work, with glassy, red, or tired eyes, or their pupils dilated? Is their behavior erratic? Are you noticing any kind of unusual cuts or sores or bruises on them? Sometimes those things can be signs of addiction, or at least the progression of addiction. One of the things that we always hear about are constant mood swings. They're good one day, but not the next. Again, this could be a lot of different things, and so it's important for you to make a phone call to us, and we'll be happy to help kind of weed out those issues, but don't let it go unchecked. We don't want you to sit on the side of the road and just evaluate the situation on your own. Use expertise, get those people involved who can help you discern whether or not you or your family member needs help right away.
Once again, if you have any questions about what an intervention might involve, maybe you have questions about, if my loved one, son or daughter, if they go into, quote, rehab, what does that mean? How long does it last? Will insurance pay for it? What's the financial obligation? Those are all obviously very, very good questions, and they can be answered with one simple telephone call. Call toll-free 866-316-5113. That's 866-316-5113 for Lakeview Health right here in Northeast Florida. We'll be right back once again with Gina Thorne, so stay tuned. Guy that didn't have a lot of hits. Used to have a coonskin hat. His name was Daniel Boone.
Coonskin hat?
Yeah, remember Daniel Boone?
I do remember Daniel Boone.
Well, that guy's name is Daniel Boone, too.
Not
but he's
the same
the
one I
singer.
have.
He's the one-hit wonder from the singer from the 70s that had a pretty big hit back in the day.
And he clearly had a memorable hat.
Yeah, memorable hat and a great name, but just not a lot of hits in him. Gina Thorne is here with us, helping us play the music, and we're talking about some pretty serious stuff, but I'll tell you what, some positive, life-changing things, too. Sometimes people hear that we're going to talk about drug and alcohol addiction, but we're really here to talk about treatment and getting to a better place, right?
Yeah, we are. We really are. So for those of you that are tuning in for the first time, Lakeview Health is a inpatient treatment program that works with individuals who are struggling with both mental health and substance abuse disorders. I think it's important to note that a lot of people think that addiction only happens to those that are under a certain socioeconomic class, and that's not the case. There's a lot of people out there that come from very affluent communities and our own communities that are struggling with this disease. Some that did not intend to become addicted, maybe had a history of chronic pain and had a surgery and ended up getting addicted to opiates. You might have others that have a history of addiction in their family, watched it growing up, and then used alcohol and drugs to cope with life stressors. And so there really is no one type of person that you see with addiction. It really could be your physician, it could be your school teacher, it could be a truck driver. It really doesn't matter. And so what we do at Lakeview is we try to treat the entire individual holistically, body, mind, and spirit. And so when you call us at 866-316-5113, we're able to manage and work with you individually on your issues and your needs. If you're struggling with depression or anxiety, or if you've got issues of chronic pain and you've found yourself using medications or alcohol to cope with those issues, then give us a call, because we have great clinical staff, medical staff that can help you safely detox off of those medications, that can help you learn about what good, healthy coping skills are in place to help you learn to live your life pain-free, or at least managing your pain, and then also addressing any of those other types of mental health disorders that may have gone untreated for a long time. And so if you're interested in learning more about who we are, you can give us a call, or you can also check us out online at lakeviewhealth.com. We've got a terrific website that's full of great information. We've been talking about interventions and how to access an intervention and what to do about getting an intervention. Our trained team on call right now can answer any of those questions for you. And then also, accessing that information, that intervention guide online is really helpful. Downloading that guide and reading through it cover to cover will help you feel better prepared when you do need to have that conversation with your loved one who's struggling with this disease.
That's Gina Thorne once again, and she's part of the professional team at Lakeview Health right here in Northeast Florida. And, of course, this is Recovery Month, and if nothing else, maybe it'll spark a little interest inside of you that, hey, there's a loved one, somebody in my life that really does need to be helped to get along on the path toward recovery, right?
Right, and we've got family and friends in our communities that are walking and breathing examples of what sobriety can look like. We've got staff at Lakeview that have had long-term successes with recovery. They've been there, done that. Many of the people that you'll call today when you're inquiring about treatment are in recovery themselves, and they can totally feel and empathize what you're going through, whether you're a family member or you yourself are struggling. We are the solution, and we want you to make sure to call us because we can help you get the help that you need in being sober and living a life in recovery.
Once again, that's Gina Thorne with Lakeview Health, and we're going to put all this information up on our Facebook page, too, here in just a couple of minutes. But in the meantime, you can go to lakeviewhealth.com. That's lakeviewhealth.com. We'd really like you to call this telephone number if you have any questions at all, including about a topic that we'll mention at some point here about intervention, actually. And that number is 866-316-5113, toll-free 866-316-5113. We're with Gina Thorne, and we'll be right back.
I know you don't know what I'm going through. Standing here.
And they were platform boots. They weren't even like the really cool hipster kind. So
like 3 feet tall.
Yes.
Boots that are taller than me. What's the tallest pair of boots you have, Gina?
I'd rather not say.
Oh, come on.
I don't think I have to be honest with you. I can't go too high or I'd probably fall. So I'm not very stable on high heels, but I have friends of mine that are, and they're very good at it.
Do they? Mm-hmm. Yeah, I don't understand. Well, I'm amazed by you lady folk all the time that you can walk on any kind of a heel.
Listen, the things that we do to make ourselves look great, I tell you what.
Gina Thorne is here with us, and of course, she's part of the team at Lakeview Health. If you know somebody in your family, circle of friends, someone that you work with who is struggling with drug or alcohol addiction, we would encourage you once again to check out the website lakeviewhealth.com. We're talking with Gina, and we're right smack dab at the start of Recovery Month. What does that mean, do you think, for folks out there that are dealing with drug and alcohol abuse in their family or in their relationships?
Well, Recovery Month is a great opportunity for people to hear more about the success stories, those folks that have really weathered and worked through their addiction and are living a life in sobriety. If you go to SAMHSA, SAMHSA.com, or maybe it's .gov, G-O-V, you can learn more about some of those great success stories. You could also visit us at lakeviewhealth.com. We've got alumni on our website that are in sobriety who are telling their stories and talking about the successes of what recovery looks like for them. So recovery is possible. I can't stress that enough. It's something that many people who are currently struggling with addiction right now may have said, well, I've tried 3 or 4 times and I can't seem to get it right. And I just don't think it's possible. It's very much possible. And I can assure you that by giving us a call at 866-316-5113, you can speak to someone right now who's been an active member of recovery, who's a part of our intake team, who can talk to you about their story, talk about their successes and what it took for them to get to that place where they're able to live a life in sobriety. And so we talked about family a minute ago, and we also have been talking about interventions. And I think, again, we mentioned it's important to go and visit us online to download our intervention guide. When you're thinking about doing an intervention, it's important for you to consider the key people, the loved ones that you need to have in that room with you when you're making that decision to confront your loved one about their disease. Some people that you may not think about who should be a part of that group is your coaches, your teachers, people who might have a significant level of influence on your loved one. It could be a rabbi or a clergy member. Even your EAP or your employer, believe it or not, might be a good person to have in the room. Sometimes people don't realize how severe their disease is until their employer is sitting across from them. And hopefully having the love and compassion to say, look, we're going to go ahead and hold your position while you're in treatment, get the help that you need, and then we'll work with you in aftercare after that. But definitely making sure to include the right people in this intervention is really important, and also making sure that you're doing it in a loving and empathetic and compassionate way. Talking to them as if they're an addict, talking to them in a shame and blaming kind of way is only going to put that person off. So obviously, you need to do it with love and compassion, which is not easy. It's a very difficult thing for a lot of people to do. But we work with professional interventionists all the time, and they do an amazing job of bringing people into treatment. If you feel like you need to hire an interventionist, we can certainly work with you in finding the right person. But if you want to try and do this with your family on your own, we've got the resources available to you as well. So Lakeview is the solution. We invite you to give us a call or visit us online at lakeviewhealth.com. We're just a click away from being the answer to the chaos and pain that you're struggling with.
Well, once again, you can really enter into recovery. It changes lives. It changes families' lives. And you really have to take that first step, though. You have to, show some initiative, right?
You do. And it doesn't cost a thing. Making a phone call to us and just talking to somebody on the other line and hearing more about what's available to us or to you and your family is definitely the first step.
Absolutely. Well, once again, Gina Thorne, thank you very much for coming by today. We learned a lot as always.
It's good to have you here.
Well, thank you very much. Once again, go to lakeviewhealth.com. That's lakeviewhealth.com. We're going to put all this information up, too, on our Facebook page. So just search for WSOS Radio on Facebook, or hopefully you've liked us by now, and you can just find it all just sitting right there. And we'll look forward to having Gina Thorne back with us again soon. Once again, call that number, especially if you'd like any information about interventions or you yourself are struggling with drug or alcohol addiction, 866-316-5113.